Thousands of healthcare workers have become victims of the deadly pandemic. They have risked their lives to take care of COVID-19 patients. Our next report will talk about the struggle of healthcare professionals during these unprecedented times. Take a look.
Doctors and healthcare workers are at the forefront in the fight against COVID-19. Around the world, they are putting their lives on the line to treat the infected. Right from dealing with the risk of pathogen exposure, working for long hours, and experiencing occupational distress to enduring physical violence as well as social stigma. Health professionals are not breathing easy. Meet Caroline Tess. She is an anesthesiologist in northern France, helping her patients make it through the deadly pandemic. But in the meantime, her own life is on hold. She lives in the fear that her parents, her main childcare providers, could get infected with the virus.
It is difficult to manage with our schedules, but I'm lucky to have my parents who can take care of the kids. So eventually we were able to manage, knowing that it was a bit difficult for me in the beginning to hand them over to my parents without knowing if I would spread the virus, if they would be at risk. During the first wave, it was difficult because I told myself I was going to keep my children at my parents' place for the whole duration of the epidemic without knowing how long it would last. And with the kids so young, for them 1 or 2 months is very long and a big part of their lives. We thought about it for 24 to 48 hours. But I know very well that if my parents fall ill, I would never forgive myself.
Parce que je sais très bien que si mes parents tombent malades, je m'en voudrais toute ma vie, quoi. C'est maman. C'est maman.
While attention during the pandemic has been focused on the toll from the virus on patients, Tessa's story reveals the hidden toll on professionals and their families who have had to reorganize their lives.
In October, we started talking about a second wave. Now for emergency health workers and even us, we were a lot less motivated, less inclined to go back to this recovery room. Because we knew that it would be difficult like the first time, except that now it's the second time. So certainly it is more difficult to get back to the grind. And we know it's the start of winter. So we are sure that it would last for a long period, but we don't know how long. In March and April, we knew that it was coming, and we could see the light at the end of the tunnel. But now in October, we don't know at all.
The world has lost many frontline soldiers in the battle against COVID-19. Mental health crisis is worsening among healthcare workers. They are struggling to endure. Bureau Report, WION World is One.
Co-presented by Skoda. Simply clever.